Among those on the front lines of this global pandemic are physicians in the very dawn of their medical career. One of them, a young woman from Hollywood, the daughter of an Academy Award-winning movie producer, as it so happens. Her passion, though, is not film, but medicine. From Immaculate Heart High School in Los Feliz to Keck USC Medical School, she's now in her first year of residency at Harvard University's Massachusetts General Hospital in Boston. Dr. Zoe Memel joins us prior to her 14-hour shift. Dr. Memel, thanks for taking the time. Let me start with the obvious question. What has it been like these past few weeks?
Yeah, so for people who are not aware of what residency training is like, prior to all of the coronavirus things happening, I've been at Massachusetts General Hospital in Boston for about 9 months now, training. You learn a ton about the pathophysiology of disease and medicine and medications in medical school, but you really don't learn how to become a good physician until you just do it. The thing that I was learning the most was just the value of human connection. When in practicing medicine and talking to patients, I've particularly found that I love and enjoy educating patients about their own disease processes and talking to family members about the disease and really how they can be their own health advocates. And I think one of the hardest parts of this whole pandemic has really been the loss of social connection. When you come in with shortness of breath, that is the last time that you see a family member until you leave the hospital. The rest of your hospitalization, we focus all of our care on trying to limit exposures with you, unfortunately. We bundle all our care so that the nurse sees you as infrequently as possible. Oftentimes, the physicians don't physically see the patient in person if it can be avoided, and that's really all just safety measures. But what that means is that these patients are in hospital rooms by themselves with all of their human connection on the phone or on FaceTime, which I think is incredibly socially isolating and just adds a whole nother dimension to how horrible this disease is.
When did you realize this was headed your way?
Starting in early February, I started my, what was supposed to be 1 month and then got extended into 5 weeks of rotation in the medical ICU. When I first started in mid-February, there were 0 coronavirus cases. I would read case studies about Wuhan, China, and I was really interested in the pathophysiology of the disease, but I never really expected it to come to the United States, and I don't think any of us were really prepared. By the end of February, we started to hear more and more about how coronavirus was affecting the United States, and we actually had our first coronavirus patients at Massachusetts General Hospital. And then really by the end of my medical rotation, our entire ICU was full of coronavirus patients. So I think it's really escalated quite quickly. And I don't know that as physicians, we've had time to process it. We've kind of just been in a crisis mode.
Healing the sick, we can imagine, is stressful in its own right. But this is an occasion where there is great risk to the healer. We hear that over 60 to 70 doctors died in Italy alone. How have you and your colleagues been able to handle with that stress?
Yeah, I don't know. It's terrifying. I think it's scary, but it doesn't really stop me from moving forward. I think I have a foolish sense of convincing myself that I'm already immune, but I do think that there is an underlying feeling of intensity and fear at the hospital. What I find pretty interesting when talking to my colleagues is none of us are afraid of getting sick and dying. We're actually much more afraid of coming home and getting our family sick and dying because we know exactly what that means, and we know that they'll be isolated in a hospital where we can't care for them. So I think we really just don't have time to be afraid. We're just too focused on moving forward.
To others in their mid to late 20s, like yourself, or any age for that matter, who don't take this epidemic or the protocols for addressing it seriously, what do you say to them?
I think that that's a really good question. It's something that I've been reflecting a lot on. I think that I'm actually really in a place of privilege right now because I have the honor of going to the hospital every day and acting on my anxiety. I know that I'm contributing to this pandemic in a way that's moving us forward while so many people are at home, kind of just reading the news and building up this heightened anxiety. I think that there just needs to be a lot of trust in the process. I can tell you firsthand that every single person who can is working as hard as they can for this pandemic to end as soon as possible, and that we really just have to come together as a community, doing everything that we can to avoid social contact and kind of try to flatten the curve as quick as possible.
But what do you think when you see people not social distancing, not taking the precautions seriously?
It's incredibly frustrating, but at the same time, I empathize with them. If you're not in the hospital seeing people dying, if you're not calling the patient's family members and hearing the fear in their voice when they have no idea what's going on and their family members are struggling to breathe and they have no idea. I think that we need to do a better job of educating young people on how serious this disease is. I wish I could tell every 29-year-old that there's 29-year-olds in the ICU fighting to survive. So I'm not sure how to solve this problem except for education and really just try to reinforce that this is a community-wide effort.
It's early in your career and the other residents at the hospital, but you can make the argument that you are now practicing some of the most important medicine of a generation.
Yeah, I don't think I've had time to appropriately reflect on it. I think that you're just so busy and in the moment that I don't think we're realizing what role this plays. But I think I'm overwhelmed with awe of how the medical community, the scientific community has just come together. Our entire hospital has stopped and every single person's focus is trying to fight this disease. The pharmacists have created their own hand sanitizer. The orthopedic surgeons are now working with the interns in medicine to admit patients. The pulmonologists and the engineers are trying to create new innovative ventilators. I'm very hopeful for the future of seeing how we can all kind of collaborate together in an interdisciplinary fashion so quickly.
Dr. Zoe Memel of Massachusetts General Hospital, we thank you for what you are doing. We're rooting for you and everyone else who's battling this disease on our behalf. Please be safe.
Thanks so much, Conan.
We'll have some final comments after this.